Hello, everyone. This is Dr. Bruni. Joining you live from Canada. You know, we're going to get into a very important topic and a very important discussion on isolation precautions. Okay, isolation precautions. So if you have any friends who are yet to join us, just invite them. They can join us live on Facebook. We are streaming live there on our Facebook page, and they can also join us live on YouTube as well. Okay, so the link to join us on Facebook, and we also have people who are joining us on Zoom. So you know what? That is the live audience, So I want to really invite you to join us. And when you join us, kindly mute yourself. Okay. Um, and, we can get things going. Okay. So please kindly make sure that you are muted when you join us. Kindly make sure that you are muted when you join us. And it will also be live in the Facebook group, the NCLEX Facebook group as well. So I'm putting the link in the NCLEX Facebook group. So wherever you are, whether on YouTube, whether on Facebook, our Facebook page, on the Facebook group for NCLEX, it is there. Okay, so you can join us and just study with us right away. Just invite your friends to join us right away. We've given Dr. Julia a little break today, so we are all partners in this whole thing, and we're getting the NCLEX preparation going. By the way, I just want to hear from you. How is your NCLEX preparation going? How is your NCLEX preparation going? Because we're going to record this session so that you can have it. Okay, so please invite your friends to join us, and then let's get going. And those live in the class, Melvin and everyone, just be ready to type in your answers if necessary, because at the end of the day we're going to ask questions and make sure that you get the best out of this. So those who are joining us on live Facebook, those who are joining us live on YouTube, please feel free, text us, type, let us know wherever you are joining us from, and then we'll get the ball rolling. Okay, so this is for those who are joining us. This is the NCLEX review, isolating precautions. This is the exam for our dear nurses. So I'm going to just dive right in, and then we will get the ball rolling. Please make sure you send the Zoom link to your friends. Make sure you send the Facebook link to your friends. Make sure you send the YouTube link to your friends as well. And this class will also be recorded so that you can have access to it. Okay, so we're going to dive right in. We're going to dive right in and get things going. We're going to record it so you can have it right away. Okay, so today, as I promised you, we're going to do isolation precautions. Isolation precautions. But before we get into isolation precautions, I want you to understand that there's great news for you. And the great news is we've given you an awesome opportunity to ace your NCLEX exam. And someone may say, hey, Dr. Boni, what do you mean? What do you mean? This is a great opportunity for you to ace your NCLEX exam. And it is because as part of our NCLEX preparation, we also give you an opportunity to take mock exams. Mock exams. And those who took the mock exam the last time were so excited. In fact, look at what one person said. He said, the mock exam was great. The content taught during lectures helped me answer majority of the questions. And the beautiful thing is that, you see, wherever you're joining us from, whether you're joining us from the UK, you're joining us from the States, you're joining us from Canada, wherever you're joining us from, you will get an opportunity to get, a breakdown of whatever it is that your score was. So this is very important for you to know, so that you can be prepared for this NCLEX mock. So please just invite your friends to join us so they can get the best out of this. Okay, so that is someone's testimonial about that, because after that we ask candidates to let us know how they feel about the whole mock exam thing. And why is this class important today? This particular class we're going to do, why is it important? You realize that isolation precautions, okay, falls under safety and infection control. And this accounts for about 10 to 16% of the cases you will meet on the actual NCLEX exam. So that means 1 out of every 10 questions you will meet will focus on safety and infection control. And that is why it is important that you take time to appreciate this particular topic. So, whether you are joining us on Facebook or YouTube, or you are in the class right now, just type yes, yes, yes. Let me know that you are following us. Let me know that you are following us. Okay. Just type yes so that I'll know that you are following us. So, 1 out of every 10 questions you're going to get will focus on safety and infection control. And that is why we are taking time to deal with it at MedCognito so far as the exam is concerned. So I just want to see your responses. Yes, yes, yes. There are people who are joining us on Facebook. There are others who are joining us on YouTube. There are others who are joining. Beautiful, beautiful, beautiful. So this guy says yes. Her Excellency Mezu says yes. Okay. Julia also says yes. So just type in your responses, and I can see whether you're joining us on Facebook or YouTube. Okay. So let's get going. The reason why we are focusing on this class is because 1 out of every 10 questions you meet in the NCLEX will focus on safety and infection control. And this falls under your safe and effective care environment category. So that is something you want to pay attention to. So look, we are diving right into isolation precautions right away. Isolation precautions. So let's go. Now, what are isolation precautions? Somebody may ask, what are isolation precautions and why is it important that we learn about it? You realize that isolation precautions, these are methods we use to prevent the transmission of infectious diseases. So I'm just going to highlight that for you. So in case someone asks you, you go to the ward, or you are practicing and someone asks you, what are isolation precautions? Isolation precautions are methods that we use to prevent the transmission of infectious diseases. Why is it important? Why is learning about isolation precautions important? You realize that it is critical to protect both the healthcare workers, everybody, nursing team, physicians, laboratory team, including, even visitors and the patients from infections. So you are protecting the nursing team, you're protecting the healthcare workers. At the same time, you're also protecting the patients from infections. Now, the NCLEX focus here is this: understanding when to apply isolation precautions based on the type of disease or infection. So today, by the time we are done with this class, you have to know that, okay, if I have a patient with meningitis, what kind of isolation precautions am I going to apply? If I have a patient with, say, tuberculosis, what kind of infection prevention and isolation precautions am I going to apply? And the key point we want you to understand is that you've got to also understand these two things. We have what we call standard precautions, and we also have transmission-based precautions. Let me say it again. We have standard precautions, and we also have transmission-based precautions. So you've got to identify which diseases require specific isolation precautions and which situations are you going to apply standard precautions. So let's start with standard precautions. Okay, so please, what were the two types of isolation precautions I was talking about? I want you to type your answers. I talked about two things right now. I want to see your answers. Those on Facebook, those on YouTube, those on Zoom. I want to see your answers. What are the types of precautions, infection prevention precautions we need to know? I mentioned two of them. Please type your answers right now. I want to make sure that you are following me. Type your answers. I want to make sure you are following me. I want to make sure you are following me. So someone says standard precautions. Beautiful. I'm looking for the second one. What was the second one I told you about? Two ways or two precautions we take to prevent disease transmission between healthcare workers and the clients. We've learned about standard precautions. And what is the other one? What is the other one? I'm waiting for someone to type the answer, whether on Zoom or on YouTube. What is the other one? Okay, good. Melvin says critical precaution. Melvin, maybe will you want to look at it well? Was it only critical precaution we talked about? We mentioned something specific. So we learned standard precaution and what else? Standard precaution and what else? Standard precaution and what else? Maybe I'll go back on my slide so that you can pick it up. Standard precaution and transmission-based precaution. So please learn those two things. So I'll just put a different highlight on it so you can be able to pick it up well. Standard precautions, transmission-based precautions. Two things. So please remember, standard, transmission-based. Okay, what is standard precautions? For standard precautions, it applies to all patients, regardless of their infection status. So whether the patient has tuberculosis, whether the patient has meningitis, whether the patient has COVID-19, no matter the medical condition the patient has, standard precautions applies to all patients. Remember the word standard. Okay, standard precautions. And what are these standard precautions which apply to all patient categories and all infections? What are these standard precautions? Number one, hand hygiene. Okay, hand hygiene. Even that one, everybody knows that hand hygiene is, standard. When you enter the hospital, wash your hands. When you leave the hospital, wash your hands. Before you touch a patient, wash your hands. After you touch the patient, wash your hand. Standard precaution. Another standard precaution is for us to know that we need to know the need for the use of gloves when we are handling body fluids like blood, like urine, like CSF, cerebrospinal fluid. So we are going through all the various standard precautions. Number three, mask and eye protection. When you are dealing with a case where there is a risk of splashes, and if it splashes, it can get into your eye. So that is another standard precaution you want to know. Number four, the use of gowns when it is likely that you can be soiled. So we've learned hand hygiene, the use of gloves when handling body fluids, mask and eye protection, gowns when soiling is likely to occur, and proper handling of sharps to prevent injuries. So, for example, if you are working with a physician and that physician has to do some procedures, okay, as soon as that procedure is done, all the sharps must be taken away. All the sharps must be taken away. Okay, so handling of sharps, gowns when there is soiling likely, mask and eye protection when there's the likelihood of splashing, okay, use of gloves when you are handling all body fluids, and hand hygiene. So these are your standard precautions. So the tip I want you to go home with standard precautions is very simple. And this is the tip. I'm going to highlight it so that we all get it right. Standard precautions should be the default protocol for all patient care, including situations with unknown infections. So with all patient care, make sure you've washed your hand. With all patient care, so far as there's body fluid you'll be exposed to, make sure you use gloves. Okay, this is the NCLEX tip for standard precautions. So hand hygiene. Let's take our time and talk about hand hygiene under standard precautions. If there is any precaution for isolation precaution and for infection prevention, which is the most important, the most critical action you need to know is hand hygiene. Hand hygiene. Now, there are two common ways we keep hand hygiene. Number one is to wash the hands with soap and water, and number two is to use, the second one is to use a hand rub or alcohol-based rub. Now, for your NCLEX, you need to know when to do hand washing with soap and water, and when to use alcohol-based rubs. Now, if your hand is visibly soiled with whatever, then make sure to use soap and water. Or if you are caring for a client with Clostridium difficile, please make sure you are using soap and water. Now, when it comes to alcohol hand rubs, what is the indication? When do you use alcohol hand rubs? You use alcohol hand rubs when there aren't visible soiling of the hand. So when will I use soap and water? When my hands are visibly soiled, or when I'm dealing with a client who has C. difficile. When am I going to use alcohol hand rub? When my hands aren't visibly soiled. So the tip I want you to go with today, I'm going to highlight that tip for you. I'm going to highlight that tip for you. Is this. I'm highlighting it. Ensure you know when to use soap and water versus when you're going to use alcohol-based hand rubs. So I have a question. I'm going to move the slide. When are you going to use soap and water? And when are you going to use alcohol rubs on the hand? I want answers from Facebook. I want answers from Zoom. I want answers from YouTube. When are you going to use alcohol hand rub? And when are you going to use soap and water? Please let me know. I want to know. When are you going to use alcohol hand rub? And when are you going to use soap and water? Please type in your answer. I'm waiting for you. I'm waiting for your answer. When are you going to use alcohol hand rub? And when are you going to use soap and water? I want to know. Those on Zoom, I want to know. Alcohol hand rub. And when are you going to use soap and water? So what's the indication? Okay, so Her Excellency Mezu says, when your hands are visibly soiled. So I'm sure she's talking about the use of soap and water. And what was the other indication for the use of soap and water? Like in terms of precautions, we said when the hands are visibly soiled, and something else. We said something else. So we said if the patient has Clostridium difficile, you want to always use soap and water. Now, when are you going to use alcohol hand rub? Alcohol hand rub. Alcohol hand rub. When are you going to use that? When are you going to use alcohol hand rub? I want to know. Alcohol hand rub. When are you going to use that? Alcohol hand rub. When will you use that? Zoom guys, Facebook team, YouTube team, alcohol hand rub. When are you going to use that? Alcohol hand rub. Yes, alcohol hand rub. I'm waiting for the answer. Alcohol hand rub. Alcohol hand rub. So we learned that we'll use alcohol hand rub if the hand is not visibly soiled. Okay, all right. So now what about personal protective equipment, PPE? I remember during the COVID period, it was a big thing. Everybody was talking about PPE. Now, PPE, personal protective equipment, protects healthcare workers and patients from exposure to infectious materials. Okay. Now, what are the types of PPEs? We have gloves, and we learned that we use gloves whenever we have to touch body fluids. We have gowns. We learned that gowns are used when contamination of the clothing you are wearing is anticipated. And we have masks and goggles. They are used for procedures likely to generate splashes. Okay, so you've got to know which PPE to use depending on the type of isolation precaution you are dealing with. So if someone asks you, what kind of PPE will you use if there's likely to be splashes, you need to know. If someone asks you, what kind of PPE will you use if there's likely, if you're going to touch body fluid, you need to know. So I'm just giving you another picture of that's the glove, that's the PPE. Okay, the mask, you know, the gown you wear, and then if you look closely, the glove as well is under the clothes. Now, let's talk about donning and removing of PPE. Donning and removing of PPE. Donning and removing of PPE. Okay, donning and removing of PPE. So now let's talk about if somebody needs to don and remove PPE, what are the principles? Donning is basically putting on the PPE. Now, what's the first step if somebody needs to don PPE? The person must perform hand hygiene. And this is very important. The person must perform hand hygiene. Okay? So you have to clean your hands before touching the PPE. Number two, wearing the gown, you've got to secure the gown around the neck and the waist to cover the clothing, okay, so that the clothing don't get soiled. Number three, you've got to wear a mask or a respirator. So here you realize that the healthcare team member is wearing a mask, okay. Then number four, for PPE, you've got to wear your goggles or your face shield, and you place over your eyes for extra protection. And the gloves must cover the cuffs. So if you look here very well, where my mouse is pointing, you realize that the glove is covering the cuff so that no skin is exposed. So that is the essence of PPE. You don't want any skin exposed. But the first step is to make sure that you clean your hands before you even touch the PPE. So I'm going to highlight that because that's a high yield point there. That's a very, very high yield point. You've got to wash your hand. You've got to clean your hand before you touch the PPE. What about removing the PPE? Removing the PPE. Removing the PPE first, you have to be careful to avoid contamination. Okay, so when you're removing the PPE, you have to be careful to avoid contamination. So what are you going to do? You are going to grasp the outside of one glove with the opposite gloved hand and peel it off, and use the bare hand to remove the second glove. Okay, now what about the goggles? You handle the headband or earpieces of the goggles. You don't touch the front because it could be that there's contamination there. And then the gown that you wore, you unfasten ties and pull the gown away from the body without touching the outside because the outside may be contaminated. And what about the mask or the respirator? You remove the mask by handling the ties or the earlobes. Okay. And when you're removing the mask, don't touch the front of the mask. Now, another trick here. Remember that before you put on the PPE, you cleaned your hands. At the same time, after you put off the PPE, when you've put off the PPE, please make sure that you have also cleaned the hand after you've taken off the PPE. Now, let's talk about transmission-based precautions. Transmission-based precautions. Transmission-based precautions. Transmission-based precautions. So let's get into that. Transmission-based precautions. These are additional precautions used for patients known or suspected to be infected with pathogens. Okay, so these are the transmission-based precautions because we said we have standard precautions and transmission-based precautions. Now, the types of transmission-based precautions are first, contact precautions. Number two, droplet precautions. And number three, airborne precautions. So let me say it again. Contact precautions, droplet precautions, and airborne precautions. Now, the tip I want you to learn here is this. What are the differences between these three types of precautions? What is the difference between contact precautions, droplet precautions, and airborne precautions? And I'm going to get into that right away. So let's talk about contact precautions. Contact precautions. Please, nursing team, if you are following me, I want you to type yes, 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 yes. Type yes, 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 yes before we move on to contact precautions because this is very important. We've dealt with standard precautions. Now we are coming to, specific types of precautions, and we are learning about contact precautions. But I want to make sure that you're following me. So if you're following me, type yes, 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 yes. Just type yes before I continue, because I want to make sure that you are really, really following me. Awesome, awesome, awesome. So Georgia says yes. Um, Julia also says yes. Any other person? Any other yes from YouTube? Any other yes from YouTube? We have quite a number of people watching us from YouTube as well. Any other yes from YouTube before I continue? Because we want to make sure that we are dealing with the right stuff. Okay, so contact precautions. Now, when do you use contact precautions? You use contact precautions for pathogens which are spread by direct or indirect contact. Direct or indirect contact. That is when you use contact precautions. Direct or indirect contact. And the common infections are methicillin resistant staph aureus, MRSA, C. difficile, RSV, herpes simplex. So these ones, so know these common infections which will need contact precautions. And what is the reason why, or what is, when do we use contact precautions? When pathogens are spread by direct or indirect contact. Now, what kind of PPE should we use? Use gloves and gowns before you enter the room when there's contact precautions. And it is used when you want to use a dedicated equipment, okay, or proper disinfection after you use it. And the tip here is that patients with contact precautions must have proper hand hygiene using soap and water, especially for C. difficile. Patients with contact precautions. So if a patient has methicillin resistant staph aureus, C. difficile, RSV, herpes simplex, you must use contact precautions for these patients. Now, in order to help us to understand contact precautions very well, remember this acronym, Mrs. We. So think about, a Mrs., somebody who is married, who pees on the bed. So Mrs. We, right? So M stands for multi-drug resistance organisms like MRSA, VRE. R, so please write this down, Mrs. We. Write it down. Please write it down. Write it down. Multiple drug resistant organisms. Then the R stands for respiratory infections like RSV. Then S stands for skin infections like impetigo and scabies. Okay. Then W stands for wound infections. Then E stands for enteric infections like C. difficile. And E stands for eye infection. So please, before I move on, I need you to write this down. Mrs. We, mnemonic for contact precautions. Mnemonic for contact precautions, Mrs. We. And the tip is that you need to memorize this mnemonic to quickly identify diseases which require contact precautions. So please, before I move on, I want to make sure that you've written it down. Mrs. We, MRSWEE, multi-drug resistant organisms, respiratory infections, skin infections, wound infections, enteric infections, and eye infections. Mrs. We. Simple. Now, what about droplet precautions? Droplet precautions. Droplet precautions. So this is for the NCLEX exam. Droplet precautions. Okay. When do we use droplet precautions? It is used for pathogens spread through large respiratory droplets. So droplet precautions are for pathogens spread through large respiratory droplets. Example, influenza, meningitis, pertussis, diphtheria. These are organisms which are spread through large respiratory droplets. And what kind of PPE do you need? You need a surgical mask within 3 feet of the patient. So if you are going to a patient like that, within 3 feet, you need to wear a surgical mask. And you need to get your gloves and your gown if there is a risk of direct contact. Okay? If there's a risk of direct contact. So the tip I want you to go home with for the NCLEX exam, the tip I want you to go home with is very simple. Know that a mask is required for healthcare workers and visitors within 3 feet of a patient with droplet precautions. 3 feet, 3 feet, the number is 3. 1, 2, 3, 3 feet. Okay? And the organisms or the infections which fall under droplet precautions are influenza, meningitis, pertussis, and diphtheria. And that's one also, we have a mnemonic. And the mnemonic is Spider-Man. So that's why I put this guy here, Spider-Man. Spider-Man. Okay? I put him there. So that is the precaution, droplet precaution you need to know about Spider-Man. And what are the components of Spider-Man? So if in your NCLEX exam, remember Spider-Man. Remember that you learned it in MedCognito. Spider-Man. S stands for sepsis or scarlet fever or streptococcal pharyngitis. P stands for parvovirus B19, pneumonia, pertussis. I stands for influenza, influenza. D stands for diphtheria, diphtheria, diphtheria. E stands for epiglottitis, epiglottitis, Spider-Man. R stands for rubella, rubella, rubella. Okay. M stands for mumps and meningitis. And AN, Spider-Man, the AN stands for adenovirus, adenovirus, adenovirus. So Spider-Man helps me to remember the conditions under which I need droplet precautions. Spider-Man. Please, are you picking up what I'm laying down? 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 Her Excellency says, MedCognito, please, I need private class. Let me know how to contact you. Sure, sure. We'll show you, we'll share our phone number when we are done. Okay? We'll share our phone number. In fact, my phone number is here. Let me share it. So look down here. +1 306 891 5649. +1 306 891 5649. Just send me a WhatsApp right now. Send me a WhatsApp right now. Send me a WhatsApp right now, and we'll be able to help you. So I'm very happy that Her Excellency Mezue is enjoying the class. So we are learning the mnemonic for droplet precautions. Spider-Man. Okay, so in my country we say Spider-Man, Spider-Man, Spider-Man. So if you want to remember that mnemonic very well, remember Spider-Man. That is what you need to know. Spider-Man. Okay, now let's go to the next one. So that is droplet precautions. Now let's talk about airborne precautions. Airborne precautions. Airborne precautions. It is used for infections spread through small airborne particles. Airborne particles. And which infections are spread through small airborne particles? They are, think about tuberculosis, think about measles, think about varicella or chickenpox. Okay, so these ones, airborne precautions. And these ones you want to use like an N95 respirator. And you also want to manage the patient or the client in a negative pressure room. Okay, in a negative pressure room. So two things, airborne precautions. Remember N95 respirator. Remember negative pressure room. Okay, N95 and negative pressure room. And I have a mnemonic as well for you. MTV. MTV. So it sounds like, you know, the name of a TV station. MTV, measles, tuberculosis, and varicella. MTV. Always remember that these three diseases, measles, tuberculosis, varicella, require airborne precautions and N95 mask. So please, before I move on, I want to make sure again, you are picking up what I'm laying down. So if you are picking up what I'm laying down and you are joining us on WhatsApp, or you are joining us on Facebook, or you're joining us on Zoom, or you're joining us on YouTube, just type yes, yes, yes. I really need your response so that I can get the best out of this class, so that you can also get the best out of this class. So if you're following this, MTV, Spider-Man, Mrs. Wee, these three acronyms, just type yes Yes, yes. So Her Excellency says, I am picking up this. It is interesting. Awesome. That is exactly how we teach in MedCognito, okay? All our teachers, Dr. Julia, Dr. Bruni, everyone, this is how we teach, all our tutors, that's what we do. So the number is +1 306 891 5649 +1 306 891 5649. Just send a WhatsApp right away. After the class, I'm going to get in touch with you and will help you to ace your NCLEX exam. Okay? We have very astute teachers who help. All of us will help you go. So now, know the difference between airborne and droplet precautions. Airborne and droplet precautions. What's the difference? These are two different types of precaution measures and methods to prevent the spread of infections. Now, airborne precautions, it protects against particles that travel through the air, and droplet precautions protect against particles that travel through the air and drop onto surfaces. So please know the difference between airborne precautions and droplet precautions. Airborne precautions, they travel through the air, and droplet precautions, they travel through the air and then they land onto surfaces. Airborne precautions and droplet precautions. That's the difference. Okay. Airborne precautions travel, they travel through the air, and droplet precautions, they will travel through the air and then they will land on surfaces. Let me move on. So, how do you know the difference between airborne and droplets? Airborne and droplets. Airborne and droplets. So, with airborne, remember the word pimp. So those who have big cars, they'll say, pimp my ride, pimp my ride. Okay. They all show like dropping low rider. And then the airborne is, I was telling that the MTV looks like, some TV stations name. So on air with MTV. So whenever you see airborne, think about MTV. Whenever you see droplets, think about pimp. Whenever you see airborne, think about MTV. And whenever you see droplets, think about pimp. Okay. So for the pimp, what are the components again? Pertussis, influenza, meningitis, okay, pneumonia. Let me say it again. Pertussis, um, influenza, meningitis, pneumonia. And for the airborne, we have MTV, so measles, tuberculosis, varicella. For the droplet precautions, you keep them in a single room, you use a surgical mask and gloves. For the airborne, you keep a negative pressure room, you keep the door closed, you wear your N95 mask for the staff, and when transporting, the clients must wear surgical mask. Let me move on. So, you also need to know the difference between standard and isolation precautions. The difference between standard and isolation precautions. The difference between standard and isolation precautions. So, let's dive into it. The difference between standard and isolation precautions. So, standard precautions, we learned that they are used for all patients. And transmission-based precautions or isolation precautions, these are added precautions for known or suspected infections. Okay, so the key point is you need to know when to escalate or when to move from a standard precaution, which we use for everybody, and an isolation precaution. And you've got to identify which type of isolation you are going to use for a specific case. Now, we're going to get into neutropenic precautions. If you have a patient who is neutropenic, maybe a patient with cancer, who is going through chemotherapy, who is going through radiotherapy, what are the precautions you're going to take for them? Neutropenic precautions are used for immunosuppressed patients. like patients who are on chemotherapy. And we use the principle of reverse isolation. So please write this in your book. Reverse isolation. It is to protect the patient from external infections. Reverse isolations. Now, one tip I want you to understand is this. If you have a patient who is immunocompromised, if you have a patient who is immunosuppressed, keep that patient away from raw fruits and vegetables. Keep them away from fresh flowers and keep them away from crowds because you don't want them to pick up an infection from these places. So please keep them away from raw fruits, raw vegetables, fresh flowers, and crowds. You don't want them to pick up an infection. So for neutropenic patients, be careful. What are you not going to expose them to? Raw fruits, raw vegetables, fresh flowers, and crowds. Now, what about if visitors are coming to visit this patient who is immunosuppressed? What should you do? Visitors must follow the same precautions as healthcare providers. So, for airborne and contact precautions, you have to limit the visitors. And you've got to make sure that these visitors are wearing appropriate PPE. And the tip is that you need to ensure that these visitors understand and they are complying with the isolation protocols, or else they will put the patient and the client in harm's way. Okay? So we are going to jump right into special considerations. Please, if you are picking up what I'm laying down, just type yes, yes, yes before we move into these specific and special considerations for our patients. If you are picking up what I'm laying down, just type yes. I want to see your yes before we, I want to see your yes before we move on. I want to see the yes before we move on. I want to see the yes, yes, yes before we move on. Yes, before we move on. Okay, special considerations for clients with special conditions. So now, what are the special considerations for a client to see difficile? If you have a client with C. difficile in your NCLEX exam, make sure that you encourage hand hygiene with soap and water. It is mandatory. The next thing, you have to understand that alcohol-based hand sanitizers are not effective against C. difficile. So when you see C. difficile, it goes with soap and water. C. difficile goes with soap and water. C. difficile, it goes with soap and water. Now, what about RSV? If you see RSV, remember contact precautions. RSV goes with contact precautions. But they may also require droplet precautions if aerosols are generated. Okay. Now, use contact precautions for RSV unless aerosol generating procedures are performed. So, contact precautions, RSV. Meanwhile, C. difficile, soap and water to wash the hand. What about environmental controls? Proper cleaning of rooms and equipment. So these are done to prevent infection transfer from patients to healthcare workers and from healthcare workers to patients. Okay. Now, use dedicated equipment or disinfect after use in isolation rooms. And the NCLEX tip you need to know that contact precautions require either dedicated or disinfected equipment. That's something you want to know. Okay. That's something you really want to pay attention to. Okay. So we have quite a number of people joining us on Zoom. So that's awesome. Now, what about how to handle contaminated equipment? How to handle contaminated equipment? Equipment used in isolation must either be dedicated to the patient. So if you have a patient who is in isolation and you are practicing isolation precautions, the equipment must be dedicated to that patient, or if you are going to use the equipment on another patient, it must be thoroughly disinfected. Thorough disinfection is very important. Thorough disinfection is very important. Now, let's jump into transporting patients on isolation, transporting patients who are on isolation. What are the principles? What are the principles of transporting patients who are on isolation? The first principle is very simple. Number one, number one, the first principle is very, very simple. Airborne precautions. Patients must wear a surgical mask during transport. Okay, if that patient is on airborne precautions, then remember that airborne precautions are, you know, are instituted if the patient has any condition which can spread through the air, right? So patients must wear surgical mask during transport. If the patient has a condition which needs droplet precaution, then same surgical mask requirements for the patients like the airborne precaution. And what about contact precautions? Remember that contact precautions, we said Mrs. We, right? So, skin stuff. So the staff should wear appropriate PPE during transport. So for airborne precautions and droplet precautions, the patient must also wear surgical mask. During contact precaution transfer, patient who probably has scabies and all that, the staff should wear appropriate PPE. Always make sure that you prioritize minimizing patient movement to reduce the risk of transmission. Always do that. Always bear that in mind. If you don't need to move a patient, don't move that patient, especially if the patient is under isolation precaution. Now, if you are transporting a patient who is on, airborne isolation, what must you do? The patients must wear surgical mask. We've talked about that. Okay, the patient must wear surgical mask. What about if the patient is on droplet isolation? A mask is required for both the patient and the healthcare provider. A mask is required for both the patient and the healthcare provider. And remember that we said that if the patient is on droplet isolation as well, the healthcare provider must make sure that within 3 feet of the patient, that person is properly covered. Okay. Okay. Now, what about contact isolation? You've got to use gown and gloves for transporting patients with contact precautions, and ensure proper PPE is worn to prevent contamination during movement. Now, we are talking about isolation, but one thing I don't want us to lose sight of is while we are isolating patients because of infection, it can have a serious effect on their psychosocial well-being. That is on their mental health. So remember that isolation can lead to feelings of loneliness and depression, especially if that patient is supposed to be isolated long term. Remember when we even had COVID-19 in the world, many people became depressed, especially when they had to go under isolation. So one thing you need to know as a nurse is to engage patients in communication and provide emotional support so that you use that to combat the feelings of isolation. Because the last thing you want is for a patient to go into isolation and then come out depressed. What about children who need isolation? Children may experience higher levels of fear and anxiety. Hey, why have I been kept here? Hey, why have they prevented other people from coming to see me? So when you have a child in isolation, you've got to make sure that you provide age appropriate activities and engage child life specialists to support their emotional health. Okay? And so remember that pediatric patients don't think, oh, we've just isolated a kid. No, the child may develop some higher levels of fear and anxiety. So please make sure that you engage that child in age appropriate activities. Now, what is the patient education tip on isolation precautions? You've got to educate the patient on why the isolation is necessary and how to prevent the spread of infection from the patient to the healthcare worker, from healthcare worker to the patient, and from patient to patient. And you've got to also let the patient know the importance of following PPE and hand hygiene protocols. Okay, so you need clear, effective communication which is essential for patients and their families to understand why isolation is being established. So, please, I want us to jump into some questions. But before we jump into the questions, did the class make sense? Please, did the class make sense today? I really want to know. Did the class make sense to you today? If the class made sense to you, type yes, yes, yes. I want to know. Did the class make sense? Did the class make sense? Did the class make sense to you? I want to know. Did the class make sense? If it did, just type yes, yes, yes before we dive into some questions, because we're going to try some questions. And after that, you're going to do some mock exams as well. Okay? Okay, good. So Her Excellency Mezue says yes. Julia also says yes. Who else? Those on Zoom. Did the class make sense to you? So Her Excellency says you are one of the best. Sure, that's why we are here. I think you sent me a message, right? After that, I'm going to respond to the message and we'll talk and we'll help get you all the help you need in the NCLEX program. So don't worry, we are here for you. Okay. Okay. So now let's get into some questions. Those on Zoom, did the class make sense? Did it make sense? Melvin, the matter, and then 743531. Did the class make sense? If it did, just type yes, yes, yes. And then we move on from there. Okay? Awesome. Okay. So let's try some questions. Let's try some questions. Number one. The first question is this, and type your answers, whether you're on Facebook or whether you're on YouTube, wherever you are. Type your answer. A pediatric client, Jacob, is admitted to your ward. It is discovered that Jacob has meningococcal meningitis. You must implement the correct isolation precautions to prevent the spread of infection. Which isolation precaution is necessary to prevent the spread of Jacob's infection? A. Airborne precautions. B. Reverse precautions. C. Contact precautions. D. Droplet precautions. Let me know your answer. Are you going to go for what kind of precaution will you institute in a patient with meningococcal meningitis? A. Airborne precautions. B. Reverse precautions. C. Contact precautions. D. Droplet precautions. What will you go for? Those on Zoom, those on Facebook, those on YouTube. What will you go for? Will you go for A. Airborne precautions, B. Reverse precautions, C. Contact precautions, or D. Droplet precautions? Meningococcal meningitis. What kind of precaution will you give? I want to see your answers. Are you going for A? Are you going for B? Are you going for C? Are you going for A, B, or C? So, Her Excellency says you go for B. Who will go for a different answer? Are you going for A? Are you going for B? Are you going for C? Okay, Melvin says he'll go for droplet precaution. Okay, anyone with any other answer? What will be your answer? A, B, or C? A, B, or C? And the correct answer is D, droplet precaution. Droplet precaution. Droplet precaution. Droplet. Droplet precautions are necessary for clients diagnosed with meningococcal meningitis, as the infection is spread through respiratory droplets. Okay. All individuals who are entering the room should wear a mask, and the child should remain in isolation until they have received 24 hours of the prescribed antibiotic therapy. Droplet precaution. Remember that A is wrong. Airborne precaution, they are used for infections spread through tiny particles that remain in the air, like tuberculosis and measles. And reverse precautions are used for immunosuppressed patients, if you remember. And contact precautions are used for infections which are spread through direct contact. So the kind of precaution you want to use for a patient with meningitis is droplet precaution. Let's go to the next question. What is the first step in donning PPE before entering the patient's room? So if you want to don PPE, what's the first step? A, put on gloves. B, put on gown. C, perform hand hygiene. D, put on a mask. What is the first step in donning PPE before entering the patient's room? Will you put on the glove first? Will you put on the gown first? Will you perform hand hygiene, or you put on the mask? What's your answer? What's your answer? I want to see your answer. Will you go for A, for B, for C? Good. Melvin says, perform hand hygiene. Those on Facebook and YouTube, what are your answers? Perform hand hygiene. Perform hand hygiene. And I think I will go with Melvin. Oh, and then Her Excellency. Her Excellency is very active today in class. Her Excellency Mezue. She says perform hand hygiene. And I think I will agree with that. Perform hand hygiene. Remember that we said hand hygiene is the first and most important step in donning PPE. Okay? The first and most important steps. Of course, putting on gloves is important, putting on a gown is important, putting on a mask is important. But the first step, if you want to put on PPE, is to wear or to wash or to perform hand hygiene. Next question. David is a 9-year-old boy who is diagnosed with chickenpox. What type of room should David be placed in? David, a 9-year-old, is diagnosed with chickenpox. What type of room should David be placed in? A, standard private room. B, shared room with patient with influenza. C, negative pressure room. D, positive pressure room. Chickenpox, where will you put the patient? Standard private room, A, shared room with a patient with influenza, B, C, negative pressure room, or D, positive pressure room. What is your answer? 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 Are you going to put in a standard room, shared room with a patient with influenza, negative pressure room, or positive pressure room? Where will you put the patient? Zoom team, I want to hear from you. Facebook team, I want to hear from you. YouTube team, I want to hear from you. I want to hear from everybody. 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 Are you going to put the patient in a standard room, a shared room with a patient with influenza, negative pressure room, or positive pressure room? Where will you put the patient? The answer is simple. Negative pressure room. Varicella is an airborne transmitted infection. So David requires a negative pressure room. Okay. Standard or shared room is insufficient for airborne precautions. And D, positive pressure rooms are used for patients who need protection from outside infections, like neutropenic patients. Okay. So what's the conclusion? What's the conclusion? What's the conclusion? Isolation precautions are critical. Please, did the class make sense to you? Isolation precautions are critical for preventing the spread of infectious diseases. Okay? Always know which isolation precaution applies to specific diseases and the correct PPE which is required. So if I mention tuberculosis, you must know. If I mention varicella, you must know. If I mention scabies, you must know. If I mention meningitis, you must know. Okay, so we're going to dive into a free mock right away. By the way, before the free mock, I hope you did not miss the great news. The great news is that we are going to have a pharmacology mock very, very soon. We're going to have a pharmacology mock very, very soon. Okay? We're going to have a pharmacology mock very, very soon. And it is going for only 29.99. 29.99. Okay? It's going for only 29.99. So I'm going to share the link, okay? And you can use that to register. 29.99. Pharmacology mock. Come and try your hands on this mock. Come and try hands on it. And those on Zoom as well. I'm going to share the link with you. Come and try your hands on it. In fact, those who took the mock, we gave them feedback and they really, really, really enjoyed it. Okay? So come and try your hands on it for just 29.99. Pharmacology mock. Come and try your hands on it. You will not regret it. For 29.99. You will not get this anywhere. MedCognito is here to help you to prepare for your NCLEX exam. Okay, so that is one thing I want you to know. We're going to have a pharmacology mock, 29.99. Just register and jump in and come and take it. At the same time, before you do the free mock today, you need to join the MedCognito NCLEX champions. You know, we have a specially crafted study planner for you. And you also have a personalized study portal which you can access on your phone, your iPad, your MacBook, your laptop, your HP, your Acer laptop, any of them. And then we even have created workbooks for you that you will use for your NCLEX preparation. At the same time, we will guide you through live classes twice a week. Okay, and we even have what you call the NCLEX snapshot. It's like review of the review of the review, so that you can be able to get your concepts quick. And we also conduct mock exams. So that's what I'm talking about. Just 29.99, you can sit for the mock exams. And last but not the least, we also give a bonus mindset coaching class. So you see, so if you come into the portal, you have all these things there. You have all your materials that you can download for your studies. You have all replays of every class we do. You have it there. You have mocks and questions that you can try. You even have, complicated newborn care. Everything is in there for you. We also do high yield review part 1, high yield review part 2, high yield review part 3. All of that is there for you. So will take you through oncology, respirology, perioperative care, pharmacology, nephrology, hematology, pediatrics. Everything you need to know for the NCLEX is in there for you. And this is a copy of the snapshot. And this is one of our huge tutors, Dr. Julia. Wonderful tutor, for your journey. She will provide you with mindset boosters. She will guide you in your exam preparation. So what I'm trying to tell you is that don't let this train pass you by. So listen to what some of the candidates have said. He said, it's been good so far since I'm gathering the courage and knowledge to write the NCLEX. The topics treated so far are all in order and I've gained much understanding. I'm hopeful I'll be able to pass the NCLEX on my first attempt if I continue with the lectures. Thank you, MedCognito. So that is from one of our satisfied clients. Another one says, thank you for the beautiful and encouraging words. Thank you all. Lecture was great. Another candidate also says, yesterday's class was very interesting, deep and informative. Thank you, Dr. Julia, so much for making things way easier. That is what we do at MedCognito. So if you enjoy today's class, that is the same way we teach at MedCognito. Okay. Another one says, thank you, Dr. Julia. Amazing class. Thank you for the effort you make for every class and the good attitude you always project to us. God bless you. Another candidate says, morning to everybody. The cardiology class was great. I enjoyed and learned a lot of things. I saw areas I need to revisit and study. Another one says, diabetes insipidus class was very awesome. Everything was simplified and that is great. Another one says, "Hello, Dr. Julia. Cardiology class was very good. The questions we solved made it easier to understand." So, what I'm trying to let you know is that you are not going to be alone. We are going to be with you. We have a 30-day plan for your studies, which goes for only 199 Canadian dollars. And you can also study with us for 6 months, and that goes for only 997 Canadian dollars. You can decide to pay it one time. You can decide to pay it over 2 months. You can decide to pay it over 3 months, 4 months, 5 months, or even 6 months. Any of that is fine. All these are there for you. So these are the payment plans. You can pay monthly, you can pay it over 2 months, you can pay it over 3 months, and we are here to help you and to guide you. So please, just drop us a comment. That's my phone number, +1 306 891 5649. Click on the link to register for the upcoming mock, and I'm also going to drop a link for all that we offer. Okay, for all that we offer. So to join our Facebook group, to join our mastermind, and for those on Zoom as well, I'm going to drop the link there as well for you. For those everywhere, I've dropped the link on Zoom as well for you. Okay, so you can use it to join us, and that would be awesome. Early bird, just $199 a month, and you get access to everything, to coaching, to everything, as well as you can register for the mock, as well as you get mindset boosters, you get the MedCognito snapshot, you get everything. So anyone with any question, anyone with any question, anyone with any question, anyone with any question, I'm dropping the links. I'm dropping the links. I'm dropping the links. I'm dropping the links. I'm dropping the links so you can um join. Now, let's try the mock. I'm going to send the link to the mock right away, and then you can use it to try the mock. You can try it on your own at home, and what we will do is that we will get you feedback as well. So take advantage of it. This is the link to the mock right now. You can try it. I'm putting it in the comment section. You can try it right now. You can try it right now. Okay, you can try it right now. I've put a link there. And for those on Facebook and YouTube as well, I'm putting the link in the comment section of Facebook and YouTube so that you can also start studying. Okay, so oh, that's Dr. Julia. She says, "Great class, Dr. Brony." Yes, Dr. Julia, sure. Thank you very much. So, class, it's been awesome. It's been wonderful. Please make sure that you are attempting the mock exam. Please make sure you're attempting the mock exam. Please make sure you're attempting the mock exam right away. Attempt the mock exam. Click on the link. Attempt the mock exam. Register for the upcoming mock exam on pharmacology. Jump into the 1 month program or the 6 months program, whichever one you prefer, and let's get to the finishing line. We are here to help you. We are here to guide you. All the best. Good evening. Solve the questions and send us your answers, and we'll be here to help you. Thank you very much. Have a wonderful, wonderful, wonderful Canadian evening, wherever you find yourself on the face of the earth. Bye bye, bye bye, bye bye, bye bye, bye bye, bye bye.